Good morning. So I'm going to spend a little bit of time talking about my organization's journey to providing some traditional foods in our various healthcare settings. My only disclosure is that I am in no way an expert on traditional food. Thank you very much for not getting up and walking out when I told you that. I'm glad. So we're starting out on a good foot here. But I did have the opportunity and continue to have the opportunity to be a part of a wonderful team that's on this journey and has been for some time now. So I'm just going to share our experiences. So one of the things, like most of your organizations, I'm sure, that was important to us was continuing to incorporate our Nikipiaq values into the care we provide. Our hunting and subsistence is certainly integral to that. And so that's kind of where this all started. In late 2015, early 2016, our organization was on the heels of quite a few very exciting ventures. We had just opened our new hospital in 2013. We were about to start swing bed services so we could provide goal-oriented longer stays on our inpatient unit. And we were working with Hope Services to transition management of the assisted living in our town in Barrow to our organization for management. So the goal was that we wanted to provide healthy food options, provide foods that our patients and our residents would enjoy, and really just continue to do things that promote comfort and healing and whole health. Our organization, of course, understands the importance of food sovereignty when it comes to optimal food access, but we also know that Alaska Native traditional foods are healthier than, many prepackaged and processed foods with higher levels of iron, protein, antioxidants, without all those preservatives, processed sugars and additives. They're full of the things that help people be physically healthy. So, we know the food influences the naturally occurring chemicals and hormones in our body, but also there's this fact that food can be medicine. We've heard from so many different presentations, and you all have so much training, an immense amount of education around pretty much a central idea, which is foods impact your health, both physically and mentally and emotionally. Eating the foods that you grew up with promote a healthier and happier state of mind. Your health is impacted by your whole body, including the foods that you eat and your mental health. And therefore, traditional food Nikipiaq helps to improve whole body wellness by positively impacting the body, the mind, and the spirit. In other words, traditional food is healing. So we were seeing at that time what some of our partners were doing around the state, Manilik and Kotzebue, ANTHC, ANMC. You'll hear some wonderful things about that, of course, from Amy. What other organizations were doing with traditional foods, and we asked ourselves, how can we incorporate these awesome principles? What would it look like for us? And we started doing some research, and of course, whenever we did research into how to bring these things on, we ran into some barriers, as will happen. Of course, as healthcare organizations, there are standards and regulations that we are held to in order to ensure safety for our patients and residents. Sometimes regulations and guidelines, although they may be to keep people safe, they can be very restricting. We're finding that there was also other challenges with being able to order traditional foods from our standard vendors. Many traditional foods that we were used to eating, they're not USDA inspected, and so we wanted to make sure that we were following all the rules that we needed to, and there were restrictions on what could be accepted or provided. So in our research and in talking to our partners across the state, we realized that we were going to have to kind of come at it from multiple angles. Of course, our organization oversees both the hospital and then outside of its Joint Commission accredited campus, we also oversee the local assisted living, as I had mentioned, we were moving towards, and then they're licensed through the state. And so because our hospital options and operations were different than assisted living, we found that there were some different parameters and regulations that we were following for each. So we started with our elders. We were already, as I mentioned, moving towards gaining oversight of the assisted living, and we asked ourselves, how can we provide our residents at the assisted living with the foods they want to eat? We found that, this was a very important part and priority in our strategic plan as we were starting the assisted living. So we came up with a list. At the assisted living, there were foods that we could accept and serve from the kitchen, but there were some limitations. You can kind of see here's some of the foods that we could serve and store from our kitchen there on the left, and then it's a pretty decent list, some really good options there. But there's also that long list on the right of things that we really had to be careful with, and things like walrus meat and our whale and our seal oil, no fermented foods, that means no Nikipiaq, that just wasn't going to do. So, because, even though I'm a nurse practitioner and I've worked in quality improvement in healthcare, I've been a nurse for a lot longer, and what's one thing that we're good at as nurses is finding a good workaround. So that's kind of what we did. We're pros at it. So basically, even though, there was some things that our regulations would tell us that we couldn't process and serve, we basically, you can ignore that list because we found ways to do that. We researched all this info, and I'll talk to you about that in a few seconds. We researched all this info. We visited Manilik. We visited their long-term care in Kotzebue to see all the amazing things that they were doing with their cyclic and taking traditional food donations, having ways to collect and store and serve that in their long-term care and in their health care. And the most important thing we found was certainly traditional foods can be provided to our residents at the assisted living. The foods were donated by hunters and harvesters, and we talked about those workarounds. No matter what FDA regulations and things like that said, opportunities like potlucks and community events, they made it so that visitors could come and enjoy and bring foods for our residents, and there was no restrictions on those. And it was important because not only did it allow us to make sure that our folks could eat the foods that they wanted, but it also gave wonderful opportunities for them to have time to spend with family and friends in the community. Okay. So we set guidelines to ensure that there was safe food practices. We actually worked directly with our licensor at the state in order to clarify what was needed to make sure that we weren't running afoul on anything that might be called out later. And here was the things that we put in place to ensure safety. You can see there's parameters around how the food is presented in quarters and whole roast, that it does have to be processed, gutted or gilled, not needing any further processing once we receive it. And then we do have special separate storage so that we can keep it safe and have that available. We work with local partners and ask for donations, and we ask about those donations, making sure that there's no situations where the animal was sick prior to harvesting, or making sure that everything was done and transported in a way that would prevent contamination. So, as I mentioned, our hospital had opened in 2013, and we had from the beginning included opportunities to include family and subsistence in the design of the hospital. So because we're held to FDA guidelines, our food is served by our dietary department. And a survey or regulatory person might say that there's certain things that we have to be careful about, or we might not be able to provide. But again, as a nurse, I love a good workaround. So we do provide space in our hospital In each room, there is a refrigerator freezer for family, friends, patients themselves to bring in all the foods that they love so that we can have that readily available and stored with them. We encourage family and friends to bring their favorite foods, and the environment itself of our rooms, it's fairly large and open so that it promotes an environment where a family is included in the care team. I worked closely and continue to work closely with our dietary staff to have a daily menu with options, things like fish, reindeer, and things like that. And then you'll hear some amazing work that ANTHC continues to do over the years as well with their availability. But we worked with our vendors, so like Cisco was one of our main food vendors, and they had things like duck and salmon generally readily available. So we keep that. And Indian Valley Meats, one of our local partners in Anchorage, has been great to work with to get some other fish and reindeer meat, things like that. And then once we were able to have a regular cycle of ingredients, I worked closely with the dietary staff, and they're so eager and so wonderful. And they came up with a menu cycle that we could readily have available with food from our vendors. You can see we have a daily lunch and dinner option that always includes something like halibut, salmon, duck, our tutu, our caribou stew. And our dietary manager is very passionate. Her staff love to get creative and come up with different ideas and ways to provide these options, and so we're constantly updating our menu cycle. We also worked closely with Chef Rob Kinnan over the years. And then last year we had Chef Thomas Andrade, who's an indigenous chef in Anchorage, come and teach some new ideas to our staff. And so just bringing in those partners and working closely with them was huge in order to be able to provide foods. As all things in healthcare go, it's always a work in progress. And there were and continue to be challenges. Food sourcing is definitely a big one. We have to constantly and actively put effort into soliciting donations, and we do so through different community events, things like our Nalukatuck, our Whaling Festival. We are always putting out radio, social media, messages to family, friends, and visitors to get them to bring in things. Our local tribal advocates have also been amazing to help us keep that sustainable. ICAS, the Nikipiaq community of the Arctic Slope, is wonderful. They bring in regular donations to our assisted living. And then again in the hospital, we talked with our existing food vendors. We also found some more local vendors, and we're able to sustain it that way. But sustainability is the biggest challenge. The pandemic made things very difficult as far as continuing to get donations and the ingredients that we needed. Sometimes it caused a drop-off in our ability to provide the foods. I feel like we've definitely recovered well, but it takes an active effort, as I mentioned, which I know we've heard from several folks about throughout the conference about how people are the most important but also limited resource. I think in these challenges that we face in some of these remote areas, and certainly we face that as well. So you really have to engage key staff. You'll have to engage local people so that things don't fall to the wayside as you have changeover in staff and things like that. For example, I was gone for several years. I was finishing up my nurse practitioner, getting some experience, and when I returned, there was definitely a need to revitalize the energy around serving traditional foods. But once we had focus on it, folks easily fell back into that passion. And again, as I said, our dietary manager is very passionate. Her staff is very passionate about it. So, and certainly our assisted living director is as well. So I'll end on this slide, which does outline our Nikipiaq values, and highlighted there, you can see how and why we continue to be on this journey to include traditional foods in our healing and wellness efforts. Thank you.
Well, hello. Let me adjust a little bit for my tallness. I am Chef Amy, and I have the amazing opportunity to be the chef at the Alaska Native Medical Center. And I get to talk to you about probably my favorite part of my job, which is serving a menu of tradition at the hospital. And as you heard, it takes a lot of work, it takes a lot of commitment, and there's a lot of hoops to jump through. Currently, we are serving about 5,000 meals a day out of one kitchen. So I like to share that because it's kind of a mind-blowing amount of food. And so in order to serve these traditional foods as much as possible, we do get really creative. So today I'm going to talk about kind of not our journey, but kind of where we're at right now and an update on a lot of the different creative ways, the workarounds, and the creative ways that we are getting traditional foods for our patients. Oh, there we go. So we looked at, and Luz is in here, I have permission to use these, right? But we looked at, what we can buy, and then our hunt, fish, gathered, and grown. So we buy a lot of different ingredients. We buy a lot of Alaskan grown items. We work with barnacle and a couple of different seaweed farms. I'm looking for another one. If anybody knows of a bull kelp farm, I need bull kelp. So you can see here we work with some of the same vendors, Cisco. We work with Indian Valley Meats, with Favco. And then because we're located in Anchorage, and a lot of the plants for traditional foods are really difficult to get because they're not really cultivated. It's not something, and if we went out to the Chugach National Forest and we decided we were going to go harvest everything we needed to serve 5,000 meals a day, I'm not certain how long that would be sustainable. So we're really, really cognizant of how we impact our environment. So I have lots of folks that I'm working with that are just as passionate as I am about getting these. So we are working with Spring Creek Farm. That's my son Birch in the corner. He was so excited about kale, and yes, he actually ate his kale. I will let you know that. So this summer, we actually worked with another project that I'll share later with the Space Farming Institute, but they helped grow some seedlings. You can see we planted some fireweed. We have seed potatoes that actually came from, I'll give a shout out to Luz's husband for that, Jeff Smank. He gave us, was able to source us some Tlingit and Haida potatoes so that we could start a crop out there this year. And then that is also sourdough. We grew dandelion, kale, mizuna, arugula, rainbow chard, bok choy, sorrel celery, radishes, mixed greens, pineapple weed, turnips, carrots, kohlrabi, calendula, and we were able to harvest. We're harvesting our Tlingit and Haida potatoes tomorrow in the mud if anybody wants to come out. 9 a.m., dress accordingly. But we grew over 3 tons for the Alaska Native Medical Center to serve to our patients this summer of Alaskan grown and some traditional ingredients. So, woohoo! Very proud of that. And they are great partners. So you can see, I love this picture. In Iowa, they grow corn, and in Alaska, we grow snap peas. I found that one to be really funny when I went out there because they were so tall. And here's some more of the rainbow chard. And I have to say that they were really amazing at how they planted this rainbow so that we have all of the colors together. This past Monday, actually, these are last year's pictures, but this past Monday we went out in the cold, in the wet, in the mud, and we went to harvest our potatoes at the Matsu Valley Experimental Farm and Extension Center. It's very long, I always have trouble with that one. But it's a UAF program, and this year was our second year, and we were able to harvest. I will tell you that we tried to use the tractor to help us dig, and it was too wet, so it started sinking. So my kitchen staff was with me. We're troopers. We went out and we hand dug 286 pounds of Tlingit and Haida potatoes, which is pretty exciting. We were covered in mud, but we've got them all back, and we will be serving those on Thanksgiving Day for our patients that are in the hospital. And we actually got a donation again this year of bison ribs, so that will be the menu this year. It will be bison ribs with Tlingit and Haida potatoes. And that's what they look like. And that is my new favorite picture of me because I'm so excited about potatoes. If you don't know, I was born in Idaho, so. Yes, they would disown me, right? One of the first things I did, actually, on a side note, when I started working at the hospital, is I stopped the use immediately of instant mashed potatoes for that exact reason. We peel potatoes. So, another partnership, the Space Farming Institute. We are doing all kinds of fun things there. This is some great pictures. This past year, I challenged Lori Irwin to grow and get fireweed to bloom in the winter. So I have to say that that was all in February. There's me being a little creepy with the fireweed, but I was so excited. You can see the actual fireweed that we brought into the kitchen, and that was Northern Lights from my yard. So all at the same time in February, we had this amazingness going on. So we're actually growing microgreens. We're working with traditional plants there. We're learning how they grow. We're learning if they grow better in different light spectrums, if they taste different. And we're really focusing on doing nutrient-dense foods. And so that's where the microgreens come in. We're trying different blends. What we found is that a lot of the traditional plants don't lend themselves to a microgreen because they take a long time to grow, right? So we're learning. The plants are teaching us along the way. But the amazing thing about this is that we're working with the growers, we're working with the chefs and the cooks and the registered dietitians and the physicians to all be part of the patient care team. So for me, that's an amazing collaboration, and that's how we should be looking at food. Here's some other, Lori found this picture of these spring rolls and said, I want you to make me these. So I made her flour spring rolls. You can see we did a lot of edible flowers. We also grew chickweed this year, and I had a lot of people say, why did you do that? Because chickweed is everywhere, right? But because we can. The challenge with doing a lot of the traditional plants as well that we're finding, we're trying to be able to have year-round access and get it to a volume that would really support what we're doing. The challenge with that is that the seeds aren't available. So we're working with all kinds of groups. If you have a youth group, or we work with CITC, we work with anybody that wants to help us go out and harvest seeds so that we can kind of have a seed bank, because that's basically hydroponics and microgreens use a lot of seed. She did grow some radishes there. That was actually with a project with the school district, but the patients got a benefit from those. And then, we got pineapple weed and dandelion to bloom. We have the ANTHC Healing Garden that's just off the courtyard. You can see there we have a lot of different plants, and we actually harvest those items and we bring them in, and it's also kind of a good teaching ground. I work with Tyonic Grown, and that actually is a community-based garden, and when they have excess, then we go through and we purchase whatever they have extra. So this year, you can see we got these beautiful lettuce and lots of scallions from them. I mentioned kelp. I am happy to share another huge amount. Again, we have large volume at the hospital, but in the past 2.5 years, we've served over 25,000 pounds of bull kelp at the hospital. So very nutrient-dense, traditional foods as well there. And we serve them in all different kinds of ways. I've found that kelp isn't, as a food, hasn't become a real profit, so it's been difficult to find farmers that want to grow that bull kelp. That variety, sugar kelp, is a different story, but that's not what my patients are asking for. So we're working on that. Come on. We work with Alaska Seeds of Change, which if you're here locally, then you know they're a behavioral health program, and they do a lot of outdoor, they do hydroponic farming, and they do, I can't think of the name of the garden. Does anybody know it? No? It's at the old hospital site. Anyway, so they have a container garden, and so we work with them. Same thing, when they have excess or when they have a great harvest, they get a hold of me. And even if they have a small amount, then we buy whatever they have. In Alaska, in February, when everything is kind of dark and gloomy, it's really beautiful to get some fresh herbs and something bright and green and delicious. This year, we were really excited to be able to work with the folks at NEMA Corporation. And, there we are. As I said, I was born in Idaho, but I spent a great deal of time in Montana. And when I tell this story, I sort of fill my Montana time, because this year I bought 60 head of reindeer. And I did. I bought 60 head of reindeer. So how we worked through this is being able to have it come to our patients only, and we're not selling it at this time. Hoping that this year, soon, they will have a USDA processing butchering site there, and then we'll be able to purchase. But 60 head, which equivalated to almost 3,000 pounds of Alaska native grown and farmed reindeer that we're able to serve our patients. And so that was a really exciting thing for us this year, and they're just some really beautiful pictures, of course. Copper River Seafood. So I have a fun story with this one. I was actually in Kotzebue last August, and there was a guy sitting on the back of a truck kind of kicking his feet, and we were chitty-chatting. You know, if you've been to Kotzebue, that's what you do. And he happened to be a VP for Copper River Seafoods, and he gave me his cell phone number. It was kind of a mistake. So in the past year, I pestered him quite a bit, and then I had a good friend cross paths with him, with his boss actually, at an event. I think it was like the tasting of salmon or something, where they were serving different bite size. So we really went after him. But if you don't know that our processing interstate for catching fish, there's a lot of items that are deemed to be waste or not used or captured, and they're either ground up and dumped, or they become pet food, but there's nothing wrong with them. They're wonderful items that can be served to people, and they're all very traditionally eaten items. So after lots of texts and pestering and phone calls and being my obnoxious, passionate self, I convinced him to get us 10,000 pounds of salmon heads and 10,000 pounds of bellies. And only that amount, because it's what I could barely store. I will say that 14 pallets are still at the food bank because I'm looking for freezer space. But that is such an amazing opportunity for us to take those items. We're reclaiming these ingredients that of these animals that we've already harvested, and we're giving them back to the people they belong to. So very, very passionate about this one. And here's the bellies and a close-up of the heads. The bellies are so rich and so velvety and so full of oil. The heads, when we cook them down, we get that really rich broth, and that's what I need bull kelp for too. Another hope and kind of dream as I move forward with this is that we can obtain larger freezer space, and that we can impact those that are our disaster planning and our disaster relief. Right now, we send MREs. We don't necessarily send anything that's traditional or culturally appropriate food. When we have storms that knock out everything everyone has harvested, there's no back supply for that. So my dream would be that we can work with these fish processors, and we can have the storage for this, so we can actually return those items to folks that really need it. Here's me pushing a big old cart of hooligan. That's another big one for us. We end up smoking those. We did try and do hooligan grease a couple of different times, and what I've discovered is it's kind of like birch syrup, that you need like 100 gallons of hooligan to get 1 gallon of grease. So it feels a little wasteful. But we did get some in the time that we did it. It created kind of this byproduct in the bottom, and I got a hold of the Alaska Wildlife Conservation Center, and they took that slurry and they fed it to the bears and to the wolves, so we were able to give them some of their traditional foods as well. Herring eggs, we're always looking for herring eggs. They're one of our more requested items from Southeast. We work with the Professional Hunters Association, so in the last couple of weeks we've done really well. I keep joking that we got a 3-legged moose, but I'm they kept a leg, but we ended up with a 3-legged moose, and we've gotten a couple other quarters donated. We also received a caribou last week from Rainy Pass Lodge, and we are making dried caribou meat, and we'll be serving it on Monday for Indigenous Peoples Day to our patients. Here is the caribou from last year. So there was a group of hunters that went out. That's a lot of legs. It was 6 caribou, and they were all out of state, and they had no intention of taking their meat, and we gladly reclaimed that meat and were able to serve that to our patients. So we take moose and caribou and deer and seal. Let's see. There's a moose head in the pot. So we do make a moose head soup, though. We have a great big, it's almost half a hot tub size, I would guess, steam kettle. We get it in there, and then we peel it the rest of the way and singe it off. And we did do moose head soup for the South Central Foundation Elders Program. Harbor seal is another one that is, obviously, we can't source it, we can't buy it, we can't really farm it. So we do have a hunter out of Haines, and this past year we were able to send one of our sous chefs that's Indigenous in training to actually go to Haines and to learn to seal hunt from her elders. And so this is a picture of their harvest. This is Chef Nicole, and she actually started with us as a baker. I'm happy to share that just this last summer she's been promoted into a chef role, and she is our first Indigenous chef at the hospital. So, and she's a girl. Sorry. So talking about how we're serving the menu of tradition, this is our patient menu. It changes all the time. There's a lot of different variety. We have about 66% of our ingredients that come in, and our offerings have an ingredient like that. It's either Alaskan or a traditional ingredient. As you've heard, it takes a ton of work to get there. Anytime anybody asks me or allows me or makes the mistake of giving me their cell phone, then I bother them and we get more donations for our program. But what does that mean? So the impact that we've had since January 2015 is over, 2,634,000 and some change patient meals that have been impacted by our traditional foods program. And that I am so proud of, because that is healing. That is true healing for our patients. And this is what true healing looks like. So that's my story.
Do we have questions from the audience?
There's a flyer back there if you want to donate.
First of all, that's amazing. I'm actually from Washington. I work at Tokeland on the Shoalwater Bay Indian Reservation, but I'm also a prison nurse. And I don't know, you guys may already use this here, but the prison that I work at in Washington has a huge garden program, and they donate like 1 million pounds of food a year to different. And so that just seems like that would be a nice relationship that could be built up here, is with your prison. They have the most beautiful gardens, like they're world-class gardens, and they grow the local food. So.
Yeah, so there are a few programs that are like that. Right now they're currently being used, some goes to our school district, and then they also are just using them themselves at the different facilities for incarcerated folks. So that is happening here, but it's not coming to the hospital at this time. They don't have enough yet. We'll get there.
2 questions. I'm curious about your funding for Grow. You grow. And then second question, do you share your recipes?
Certainly. Okay, so funding. Funding for me is incorporated into operating costs. We don't currently have, I actually have our grants team. I'm begging our grants team to find options so that we can, have larger storage and we can have more going on. But currently it's all operationalized. So if we're buying things, then we're held to the same kind of standards of making our profitability. So we get really creative and we work really hard to meet those standards. And yes, if folks need helps with recipe development, if we have recipes that people are interested in, I'm certainly always willing to help and share and however I can. Yeah.
Yeah, same thing. And what we found, these are budgeted into our operational costs, and getting foods, especially to remote sites, is expensive. And so the offsetting cost is not really that different. You have to feed your people, and so trying to make sure that we plan for this and have those foods in our regular ordering cycles in between working with the different vendors and things like that. It really hasn't changed the budget that much. And then the other piece of that is certainly with some of our sourcing options as far as gardens and things like that. We have been able to work that through the SDPI program, and then in cooperative extension with other local, the municipality and other local groups like the Ellison College and things like that, so that we kind of combine those efforts, and certainly that helps with the resources as well.
This is just a pure curiosity question. Where are you processing like the large animals like the moose? Is that in the hospital or off-site somewhere?
Yeah, so if we get large, at the hospital, if we get large donations and we're not able to process those in-house, in the kitchen, all those legs you saw, Indian Valley Meats has a time frame where they won't pass a certain date except caribou because they're deemed to be in rut. And so they won't bring it in. So all of those caribou legs we processed in-house. Generally, when we're doing it ourselves, and we'll do like a stew meat, we'll saw the bones down, we'll do those kind of things. If I'm having them process it, a lot of times I'll have them grind it so that it'll stretch a little further. When we're trying to feed 5,000 meals a day, then we're trying to kind of stretch those ingredients a little farther. So it really depends. The three-legged moose that we got last week was in the middle of a pretty busy day of catering, so Indian Valley picked that up for us. The caribou that I got this week, we were a little bit slower, so we processed that one in-house. I don't know what you guys do. Do you butcher your own?
Yeah, so definitely we get a lot of things already ready-made and processed in the way that we want them from India Valley Meats as well. And then certainly just as a functional kitchen in the hospital, we have the capability to do any of that additional processing, for stew meats and things like that, that we need to. And then at the assisted living, yes, we have space that in our kitchen that we make open and available to be able to prepare those meats so that they can be provided in whatever meal we're making for the residents. Mm.
Do you ever allow the residents or elders to help?
Yes, always, especially when we are doing, bigger meals and celebrations and things like that. Like everybody gets hyped up for it. Absolutely. Great question.
Not seeing any other questions? No, thank you ladies so much.